My name is Dan Colley. Up until 3 or 4 years ago, I was a professor at UGA, where I taught immunology and parasitology. And before UGA, I was at the CDC, and before that, Vanderbilt Medical School. So for about 50 years, I've been doing that, and in about 3.5 years, I've been retired. I like to work in the yard, and I couldn't do that if I wasn't here testifying for Dr. Patil. Well, this was a while back. In 2018, I started having trouble with my back, and I had trouble walking. I was doing a lot of flying at the time. I do a lot of international work because of what I do, and so 10 or 15 times a year doing international flights, and my back was giving me trouble. And a couple of times it really sort of crippled me up, and I wasn't very functional when I got there. So that was a problem, and I went to Dr. Durr for physical therapy, and I saw Dr. Thomas for some shots in my back, all of which helped some, but not really. And so Dr. Durr suggested that I might go see Dr. Patil. Dr. Patil was the one that he suggested, and so I showed up here at Regional Athens, and we talked. I met his staff, and then I met Dr. Patil, and we talked about my back, and we looked at pictures of my back. It was still giving me a lot of trouble, and I was still going to physical therapy. When I met with Dr. Patil, we talked about laminectomy versus full-born, go ahead and get the back done with fusion and rods and screws. And I opted for the laminectomy because, as we talked about it, I thought it might be the lesser of two evils. And he said, yeah, that's right, but I can't tell you that it will definitely work. And so we did the laminectomy, and that was in January of 2019. And it did help. It helped a lot, but it didn't last very long. And pretty soon my back was giving me trouble again, and I was back at physical therapy. I was back with Dr. Thomas, and finally I said, this isn't working very well, and so I think I need to go ahead and get fusion and rods. So Dr. Patil and I talked about that. This was probably by August or so of 2019. And I'd been having this trouble, and at one point I couldn't walk a block and a half. I had to just stop, and it wasn't much fun. Traveling by air wasn't fun at all, especially going economy, which on a grant you do. And so I talked to Dr. Patil. He said, you know, this is what we would do if we do it. And I actually flew to Washington and got a second opinion from a neurosurgeon that I knew there, that was a friend of, a colleague of a friend of mine. And we went through the same thing and looked at the same films. And he said, yeah, that's what I would do too. And we talked about it. And he said, you know, people fly in here all the time and do this from out of the country and things like that in Washington, you know. And he said, but, and I would be glad to do it, but I'm going to do the same thing this guy in Athens is going to do. And, you know, there might be one or two little things different about what we do, but he's going to be doing the right thing. And you'd do a whole lot better to go home and have it done at home. And I said, fine. And we flew back, and we set it up, and I had a couple more trips, which weren't fun. I came home from one of those week-and-a-half long trips, and 2 days later, I had my surgery. So I was ready. I was very ready. And, you know, throughout the whole thing, Stephanie and the staff were very good. Everyone explained things to me fine. I looked at all the films. I looked at all the films with Dr. Durr. I looked at all the films with Dr. Patil and with Stephanie, and we went ahead and did it. And I have great shots on my camera of a beautiful job, which I've shown to other radiologists who say, wow, he really did a great job. So how can I complain? Post-op was fine. I was in the hospital for 4.5, 5 days, and went home, was pretty sore, and I took my drugs, and I went off my drugs on the right schedule, and I was fine. A week and a half later, I was walking around the house. Shortly after that, up and down the driveway. And after a while, a lot of walking. And I did a lot of walking, 10,000 steps a day, when I couldn't have gone a block and a half. So I think I'm pretty happy with what happened and how it went. The post-op meeting with Dr. Patil went fine. He looked at it, said, oh, one of those screws is a little maybe loose, but it'll fill in. And Dr. Durr has seen it since then. It's filled in. All of that went fine. The whole procedure was easy to understand, and I was asleep. I didn't have a problem. I've had a lot of surgeries. I've had some big surgeries. This was a big one, but I've had a lot of surgeries, and some of them left, 15-inch scars on your belly, and some of them left them on your knees, and some of them left on your endarterectomy on your carotid. This was simple, and it worked. And I don't know what else to tell you except that I'm very pleased. Dr. Patil and the staff and the hospital, the whole thing went fine. There was a time when we thought we ought to take out a room in the hospital, rent one for, just in between surgeries. But so far, so good. And I'm almost 81 years old, and I work in the yard, and I couldn't have done any of that without the surgery on my back. It wouldn't have been done. So am I pleased? Yes. Would I recommend this to others? Yes, I would. If they're in pain and you've tried physical therapy, because I think that is worth trying first, because it can work, and then you won't have the problem with surgery. But if it doesn't work, then I would recommend going ahead. And my experience with the laminectomy would tell me to go ahead and do the whole thing, but I didn't know that, and Dr. Patil gave me all the options, and that was my choice. So, I'm perfectly happy with that. So that's what I would do, and I thank everybody involved. They were very, very good. They explained things, which I really appreciate. If you're not going to explain it to me, I'm going to leave. I want to know what's going on. I taught in medical school for 21 years. I taught medical topics. I was division director at the CDC for 9 years. I know medicine as a PhD does. I'm not an MD, but I know how to talk to people about these things. So I put a lot of stock in someone sitting and telling me what they think and what I might think and giving me options. And if I don't get that, I go somewhere else. I haven't had to do that, so that's good. I knew exactly what they were going to do. And I did go up and get the second opinion, and I had his whole run through on it and what was good and bad about it and what it might or might not do. I had Dr. Patil's. They were very comparable. The guy in Washington was good, and I'm really pleased I did that. It was a cousin of a friend of mine in Washington, or he would never have fitted me in time. And I went up, And my wife and I went up and flew up and sat for 2 hours with this guy as he went through everything with me. And his final advice, as I said, was, look, if I do this here and it screws up, nobody down there is going to want to mess with it, and you're in trouble. And I went, yeah, and he's going to do the same thing you're going to do. I'll see you later. Adios, I'm going back. And, you know, and that was very helpful. So I do think people ought to get a second opinion. This is a big-time surgery. My other surgeries, most of them I didn't have an option to get a second opinion because it was going to save my life. And I thought it was a good idea to save my life. So I was prepared. They did a good job, and I'm walking and cutting down the tops of trees that are 60 feet tall. I mean, you know, what can you ask for?